Hi, I'm Dr. Sharjeel, and today I would like to show you three female patients who had trauma that presented to me with a similar sign around the eyes. One patient you can see had trauma to the forehead 3 days back. You can see the mark of the trauma above the brow on the forehead, and that's the other patient who had a trauma mark RTA with laceration on the cheek, and the third had also trauma to the forehead above the eyebrow, and all three presented with that black pigmentation around the eyes. So what is that? That is called black eyes. So I diagnosed all the three patients with a sign called black eyes. Now, the black eye is also a misnomer because the eye is not black. It's the surrounding skin that is black in color rather than the eye itself, which is of normal color. Name is given due to the color of the bruising because the blood is accumulated beneath the skin and around the eyes. Now, why blood seeps from the area of the injury remote and accumulates around the eyes? Well, because the skin around the eyes is very loose and there is a lot of potential space for any fluid to accumulate. So the fluid fills up, the blood fills up underneath the skin around the eyes. It tends to accumulate and then results in black eyes. Now, if you get a unilateral black eye, that's due to the injury to the face, surrounding structures of the eye. Like here in this patient, you can see the laceration mark on the cheek. And the surprising element is that the injury is below the level of the black eye, but as the space is present in that particular area of the face, so the blood goes up and accumulates around the eye and causes black eye. So a unilateral black eye is due to the surrounding structure injury, and it's a relatively harmless condition. It heals on its own. You can give the painkillers and symptomatic treatment. You can also put ice, cold compress as well. And you should tell the patient that the black eye will go slowly and gradually. You can notice the change in the color of the black eye as the hemoglobin goes through different stages of metabolism. Now, if you get bilateral black eyes from the head trauma, then it is called panda eyes because if you look at the, now this is panda, you can see that the blackish areas around the eyes. So that's why when a person gets bilateral black eyes, that is called panda eyes or raccoon eyes, because raccoon, now that's the raccoon, because raccoon has also got blackness around the eyes. Now that's a little bit dangerous condition if you get a head trauma, because the blood leaks into the soft tissues around the eyes, and you have to rule out basal skull fracture. Now, how to rule out the basal skull fracture? Well, you will find CSF or inuria, you will find CSF autoria, You will find hematoma or bump on the forehead. You can have bleed from the ear, hemotympanum, and bruise behind the ears, which is called battle signs. So all these signs will also assure you that the patient is having basal skull fracture. So that was all about the black eyes, unilateral as well as bilateral black eyes, that most frequently you encounter in your outdoors in ophthalmology. Thank you very much.